So there's a lot of really interesting things going on in our industry, and obviously first and foremost at the top of the charts is meaningful use, meaningful use, meaningful use. And it's because, 2014 starts in a few months. A lot of organizations are really trying to figure out what is their answer from a patient portal and a PHR perspective. We are hearing loud and clear from organizations with 1 to 2 doc clinics all the way through to, hundreds of hospitals in a system that they all have the same needs. And so we're really looking to create models that accommodate those small practices and small and medium-sized hospitals, and really looking to accommodate also those larger systems who have really specific needs. In the larger system realm, we've also seen trends around those systems looking for a need to liberate the data and bring it in one location. So most major hospital systems do not have one electronic health record. They have tens of electronic health records, various different versions, various different systems that they're utilizing within their hospital systems. And so they don't have a way to bring the data in a way that brings it, collectively to create a longitudinal patient record. And they're looking and leaning on health information exchanges to serve that purpose, and actually creating their own health information exchange, what is deemed an enterprise HIE. And so creating those enterprise HIEs then allow them to have that longitudinal patient record, and then allows for a patient portal or a PHR like us to be connected directly to that one source. So you can normalize the data and then present it in a truly comprehensive way to the patients. And so that's been a really interesting trend. We're seeing a lot of large practices, large organizations, large hospital systems move in that direction. We've also seen that many of the smaller and medium-sized practices are looking to a way to meet meaningful use, but not for a complex type system. And so we're looking at ways in how can we package our solution, allow organizations to pick a skin, a color, and a logo, and then make that portal available to them with a connection through a statewide HIE or a regional HIE. And so we're working, Arkansas Share is one of the HIEs that we're working with. We'll be announcing a few more over the coming weeks, and utilizing that to meet a specific and really important need for those practices in those small to medium-sized hospitals. We're also really looking at creating and establishing strong relationships with health information exchange vendors. And so we already have the privilege of working with Caradigm. We'll also be announcing a few other health information exchange relationships over the coming weeks. So lots of exciting things going on in our space. Specifically, though, what exciting me the most is now we're talking about bringing the data together and giving it to patients in a way that they can see not only snippets of their health history, but now really look at it holistically, which is what we truly need to do to help engage and empower patients appropriately.